Here on GameChangers, we're all about helping you stay ahead of pharmacy practice. But why stop at listening? You can earn CE credit for this episode and hundreds more by visiting CEimpact.com and logging into your account or creating a new one. Get credit, get inspired, and make your learning count.
Hi, everyone. Welcome to the GameChangers Clinical Update Podcast. I'm your host, Rachel Maynard, and I'm excited to dive into our discussion today about functional medicine. There's growing interest in functional medicine, and more patients are coming to us as pharmacists with questions about things like supplements, specialized testing, and root cause approaches to chronic disease. So today, we're going to clear up the confusion about what functional medicine is, examine where the evidence is strongest, and clarify how to navigate these patient conversations using an evidence-based and patient-centered framework. And I'm so pleased to welcome our expert guest for this topic, Dr. Josie Phillips Ross. So welcome, Josie.
Thank you.
Great to have you. Very happy to have your expertise here today. And to help our listeners learn a little bit about you, maybe you could share a little bit about your background and your current role and why you're passionate about this topic.
Sure. I first opened a retail pharmacy about 14 years ago, and right outside of Kansas City, Missouri. And first we kind of started with just the general delivery and patient-centered approach for having a retail pharmacy. I started getting a lot of questions about how I can help patients in different areas of their life. And it really made me curious to start my own research on or go down the pathway of learning about functional medicine. So that's kind of how I started. It was patient-centered, and a lot of it came back to bioidentical hormones and specific supplements that they asked me about, or testing is more in the last 10 years, but the questions from the patients is what got me interested in going down the pathway of functional medicine. So that was almost 10 years ago now. I completed a A4M and Advanced Endocrinology Fellowship, as well as got my A4M practitioner license and completed an IFM, which have a practitioner license there. And so now we run a compounding pharmacy, a functional medicine consulting business, and then a retail pharmacy. So that's kind of how I got started. It was based on patients asking me for help. And so now that's what I do full time.
Yeah. Well, and one of my questions was going to be, thank you so much, Josie, for that background and also for spending the time with us today. I know you're super busy, got a busy practice. But that was going to be one of my questions is, why do you think, even in the last 10 years, so this started early for you, but I think even more recently, functional medicine has gotten a lot of attention, a lot of buzz, sort of this term I shared with you. I'm not super familiar with it. So I think helping us understand what functional medicine is and how it's different or similar to sort of that traditional conventional medicine. How would you describe functional medicine to a colleague?
So when we're talking about functional medicine, we are talking about an individualized approach, right? So it begs the question, why? Why do you have diabetes? Why do you have hypertension? What kind of scenarios, lifestyle factors, environmental factors, genetic factors got you into these chronic disease states in the first place? So I think it truly goes back to the why of most chronic diseases, and tries to peel back the layers to figuring out the root of these chronic diseases and how to fix their root. That's why we coined the term root cause medicine. Instead of putting you in the box of treatment-based, it's more of prevention and or looking for why you have these chronic disease states in the first place.
Okay. So that's great clarification. And I think that focus on prevention versus treating after the fact is so important. And I think we can all agree with that. That is something we've all learned about in pharmacy school, is the importance of prevention. But that sounds like the foundation of functional medicine versus the treatment after the fact. And again, as pharmacists, we're often thinking about the medications, the treatments, but reframing that and focusing more on prevention. That's a fair summary.
Yeah. And I think in when we're taught as pharmacists, right, we get all of the knowledge of the drugs and how they work and all of that, but very little about lifestyle factors and environmental factors, genetic factors, like those types of things that play a huge role in these diseases. So peeling back the why. Functional medicine to me is figuring out the why.
Okay. Are there any other sort of, you mentioned the root cause, but also that personalized care and really focusing on the patient. So the why for that patient, right? And so digging a little deeper into all of those specific factors that might have come up for them, and that's leading to where they are now. And I think that really ties in nicely with what you shared earlier about patients coming to you asking these questions, and maybe you were encouraging them to ask that why and to dig a little deeper into why they got to where they are now. So it makes me wonder, why do you think patients now more so than ever are interested in functional medicine, hearing about functional medicine, wanting to pursue people with expertise in this area?
Yeah, great question. I think that obviously social media has brought a lot to the forefront, and asking more questions and being your own patient advocate. I think that that's so important. I think our healthcare system is overburdened everywhere you look, right? Our chronic disease is about 60% of Americans now. And there's many factors to that reasoning, but we have to figure out another pathway. We are overburdened with chronic disease, so we have to figure out the whys at this point. And I think the patient population either isn't getting answers to their specific questions and they're looking elsewhere, or trying to be their own patient advocate to figure it out for themselves. We're seeing a lot of that now.
And I agree. I mean, information is also more widely accessible too, not only on social media, but AI and everywhere. So yes,
Yeah.
they are accessing information that they didn't have 10 years ago, and leading
Right.
to some of these questions for themselves, and looking for expert advice, and coming to us as pharmacists, I think, oftentimes for that, which is, or if they're not, maybe they should be, and we should be
Yeah.
serving as that expert. So
Yeah.
you talked a little bit about your training here and in this area. So for people listening, I mean, what sort of additional education resources, where can we be thinking about getting some additional information if you're new to this sort of space?
Yeah, I think starting with the questions of why, right? If you're a pharmacist and you're questioning, okay, why is this patient on 16 meds? They're coming to me asking about all these side effects. Like, what can I do in order to help them become healthier in general? Like, we all went to pharmacy school to help patients, correct? Not give them more disease burden and more drugs, right? So I think peeling back that layer of the why, and then if you're curious on functional medicine, there's a lot of different programs out there to learn. The ones that I was trained in, obviously, but there's also tons of publications now, many resources, many books, many MDs that are practicing this way too. So coming out with different publications and books as well. There's lots of places to start when you're looking into functional medicine now, as opposed to 10 years ago when I started.
Right.
Yes.
And that's where I do think it's this term that's getting a lot of buzz. And so thank you for helping to clarify that, and also sharing some of those concepts related specifically to functional medicine and where that fits in. So in terms of that overlap with conventional medicine, where would you say are the biggest areas of overlap? Again, we think about prevention in traditional medicine too, but would it be sort of lifestyle sorts of modifications that we should be thinking about? Where are those sort of common areas of common ground?
Yeah, so I always say that you're going to need both functional medicine and conventional medicine, right? For treatment basis. I would never take a patient that has diabetes off of their diabetic medications, right? We would teach them, through different programs of CGM or testing, or we would teach them what their body needs in order to decrease on those. But I would never start with, like, you need to go full functional medicine or full conventional medicine. I think it has to be a bridge of both. But where we both find common ground is the lifestyle factors. Functional medicine is more based on those, and conventional medicine brushes the top of that, right? From what we're taught on our one nutrition class, or you know what I mean, the small lifestyle factors that we get in diabetic education. So it's more about teaching and learning, and on that front for lifestyle, environmental, all of those things. But they both need to be used together, is what people do not have to go full force one or the other.
That's a great point to clarify, because even if you have a patient who's interested in functional medicine, seeing a functional medicine provider, it doesn't mean they're not coming to your pharmacy for
Right.
their
We would
prescription
still
medicines
recommend
too.
to have a primary care provider, because I'm not going to treat the common cold
Right.
and sinusitis and stuff like that. So yeah,
Right.
you definitely need both.
Okay, that's good clarification. So the fact that this is still sort of a growing area, I think, begs the question of, well, what is the evidence to support the various interventions that might be done in functional medicine? And maybe you can share a little bit about what sorts of interventions are maybe thought of commonly with functional medicine and the evidence to support those, and how that may vary based on the specific approach you're talking about.
Right. So there are a lot of things with strong evidence in the lifestyle category. Obviously, diet being one of those. Mediterranean diet has tons and tons and tons of studies. Lots of evidence to support that type of eating and anti-inflammatory lifestyle. So diet is one area. Exercise also has a ton of studies and support and evidence, as well as strength training. And then there are some studies with supplements, specifically like omegas, vitamin Ds. Creatine now is a new one that's getting a lot of support in studies. There's definitely a lot of evidence for those types of things.
So how do you go about assessing, like say you have a patient who hears about a particular supplement, for example, how do you go about assessing whether that is something that what level of evidence there is to support that particular supplement and how that fits in with the patient specifically? I know that's a pretty big question. So maybe when you're thinking about a supplement, for example, or any other intervention, how do you go about assessing the level of evidence to support that intervention?
Okay, good question. Because that needs to kind of start out with supplements don't have the billion-dollar industry that other drugs do. So the studies are limited based on support from other groups. But I typically take it patient by patient basis. So my job is to assess the full patient from their history to their symptoms to their family history. And I kind of match, and labs. We evaluate tons of labs. So I work through the knowledge that I have gotten from the different education places that I've gotten. They provide tons of resources and studies for everything in particular that they're teaching, obviously. So that's a great resource to have. But this is very patient specific. So I think that that's important to learn. And when you're a pharmacist and you're at the counter and somebody's asking you about a supplement just right off, you're doing 1,000 things. There's just a few that obviously you need to be aware of, for the anti-inflammatory purposes or the drug depletions that I know we'll talk about. There's not a lot of time for a pharmacist to truly dive in to the evidence supporting supplements with everything on their plate. It's that's why this whole other career path has been born, for people begging the question and wanting more answers and wanting more time. So my consultations are typically 30 minutes to an hour per session. So you can get that time and individualized treatment protocols, lifestyle factors, all of that.
And in those sessions, I'm thinking you probably do like a medication review to be able, and including supplements, all basically, again, that holistic approach, right?
Yes, absolutely.
Yeah. So you mentioned a few examples like the Mediterranean diet and omega-3s, and then some other, and like you say, there's thousands of supplements out there. So it's really hard to keep up with all of them and all of the emerging evidence with them. And so again, with any specific intervention, I think we were chatting a little bit earlier before the start of the podcast about how there's a sort of spectrum of evidence with anything in medicine, and including functional medicine, from randomized controlled trials, which are often considered the gold standard, all the way to sort of expert opinion or anecdotal evidence that from a patient as you're working with a patient. So, there's that whole spectrum. And I think that's where it gets a little difficult with thinking about evidence-based approaches, because sometimes you are tailoring to the patient and what works for them. And, that's very specific. Maybe you could speak a little bit more about that, or some experiences you've had.
Well, and truly, I was talking to you too. It's all about like trial and error in this field too. Because all of my training, I've been in this world for 8 to 10 years. And so obviously I know what works now. I know what doesn't work. I know what patients respond to. I know what they don't respond to. I know what testing to do. I know what testing not to do. So it's been a labor of love per se for a long time. So just diving in feet first, obviously is hard to do in this realm without the education piece. That kind of gives you the forefront and the background to start with for functional medicine. But yeah, it's a tricky field to navigate, I would say.
Yeah. Yeah. Well, okay, because that's tricky. And we're talking at very high level here. And there's, I keep saying interventions, but what are we specifically talking about? So one example that I think is helpful to think about is with drug-induced nutrient deficiencies or depletions. And that's something that many pharmacists may know about regardless of their background, simply because we know there are certain prescription medications that lead to some of these deficiencies. So maybe you can speak to a few what that means in a bit more detail than what I just said, and also some examples that often come to mind and how you manage those when you see patients on these medications.
Yeah, so I would recommend to all pharmacists to have a chart to print off for them to be able to recognize in a quick manner what is being depleted. But also, we also talk about these drugs giving the deficiencies and causing them, but we don't consider what's happening in the background too. So what if like metformin decreases B12? So what is B12 used in? What is it a cofactor of? All of these support systems. And
Okay.
we talk about it and kind of throw it in the air like, oh, you need B12, but like actually go back and why do you need B12 in your body? Like, what is it used for? What processes is it needed for? Same thing with like birth controls. Birth controls are a big one that deplete many nutrients. And all of those nutrients are used for specific things in your body. So not only is it a nutrient deficiency, but it might be causing a lot of symptoms in your patient that you might be completely unaware with. Fatigue being one of those, restless leg syndrome being one of those. Like, there's tons of things, brain fog, skin type reactions. There's tons of things that the symptoms could show up because of these nutrient deficiencies that we're not even considering. We're just throwing around like, oh, this drug can cause that, and maybe mentioning it to a patient, but not considering the background of what it could be causing for that patient.
And I think that goes back to your earlier point. Why are you having these symptoms? And ruling in medications as one potential cause before you can rule them out, and sort of thinking through that whole perspective and possible consideration on why that might be having those symptoms or that problem.
And one area that I always hone in on is detoxification through the liver process, right? There's 3 processes of detoxification. Most of those need tons and tons of nutrients to help make things soluble and get out. And a lot of our food is stripped of it. And now we're getting drugs that are stripping our body of those nutrients. And so it's like a twofold approach. Like, if we can't process things out properly, now we're having all these symptoms on top of that. But we don't even consider that when we're talking about these drugs just causing depletions. You know what I mean? So getting a chart to let you know, like, and then putting the why behind it. Like, if a patient is deficient in iron or B12 or vitamin C, what is that causing and what's that going to show up? Like, if a patient comes to you and like, I'm so fatigued, and you look at their patient profile, like, oh, you're on metformin. Like, this is what we can do to hand-in-hand approach. That is like the number one place for a pharmacist to start. But you have to question the why. You can't just put the horse before, right? You have to question the why and what is it causing in the body in order to actually put the elements together with the patient and the symptoms. I think that that's the most important part, because we do throw around that a lot as a pharmacist, and even in the hospital, it's gaining some traction, right? We're giving OTCs in the hospital a little bit more, but pharmacists aren't considering what's that doing or symptoms that's exhibiting in a patient to put those together. So I think that that's more important to go back to the why too.
Well, and I like how you called out that this is a very narrow consideration. The why helps make it broader, but also thinking about, okay, even if this person is potentially taking a medication that might deplete B12 with metformin, for example, there's also the dietary considerations. It goes back to the nutrition and your total lifestyle approach. Yeah. And so it really does tie back to sort of that preventive and holistic concept, and ensuring, okay, we're not just necessarily giving you a B12 because you're on metformin. It's because we also have to think about, what is your diet like otherwise, and how is that contributing to your overall health?
Yeah. There's huge misconceptions with diet as well. In our healthcare today, I would say. I feel like, especially when I was sitting in functional medicine school, I was like, this needs to be public knowledge. Like, this needs to go out to everybody. Everybody needs to learn the nutrition piece aspect behind all of this. We would all be in a much better place if we did, and maybe not need as many of these interventions, but that nutrition plays a huge role, right, with how you feel. And there's a lot of misconceptions too with symptoms nowadays, like, oh, you're getting older, you're probably going to be more fatigued, or these types of hormonal issues. It's normal to be constipated, or it's normal to have gut issues, or feel bloated. Like, those things are normal, but they're really not. And so honing into the why that's happening behind that is really important. And knowing that these things might be common, but they're not normal.
And yeah, going back to that idea of the patient advocate and wanting to not just saying, okay, I guess I have this symptom and I'm going to live with this for the rest of my life, but digging a little deeper to find out what might be able to help with that.
Yeah, absolutely.
And so when thinking about maybe those conversations with patients and how to help direct them to what's going to most benefit them, where do you start in that sort of triage process? Like, what are some the key things that you're thinking about when a patient is coming to you maybe with a symptom, and how do you identify what might be the cause?
Yeah, so I look at all of my patients like a puzzle, and I'm putting the pieces together. And I've done that from the start. I love puzzles. I love logic problems. Like, that's what I love to do. So it kind of fits in right where with what I love. But I usually use the canvas of what we have, lab-based wise, symptom-based wise, history-based wise, just even like the small factors of like heat sensitivity or chemical sensitivity. Like, those things all matter when you're talking about symptoms and causes. So I like to put the why in all of those categories and go kind of brush back. We go through diet, we go through lifestyle, we go through all, obviously, medications, diagnoses, OTCs, family history. It's really a deep dive into why and how they're feeling right now. A lot of my patients are hormone patients. We do a lot of bioidentical hormones. And so a lot of those factors come into play, especially when we're talking about metabolizing hormones out. Are you doing things that are hurting or helping that process? Those are key things to look for, and they're important to me, as far as doing no harm, extra harm to the patient, and making them feel better, obviously. Because you're going to gain patients just by them feeling better, truthfully. It doesn't even have to be a lab number. It's just like, this pharmacist made a difference in my life because I feel this much better on these specific symptoms.
Absolutely. Yeah. I think we can all relate to that, right? Where we've had patients that we've made a positive difference. And if you can do it with something, I say as simple as a lifestyle change, but as maybe benign, I don't know what the word is, but something that's simple and just something maybe they hadn't thought of in the past, that can make a huge difference.
Yeah, I agree.
So when thinking about, you mentioned sort of the, I think you alluded to the safety considerations. And so are there any sort of red flags that you would want a patient asking about some particular product or process? Any safety considerations that people who aren't as familiar with functional medicine should be aware of and helping patients steer clear of?
So first thing that I consider, especially on the supplement base, is professional grade, ones that have certificate of analysts of exactly what's in them. It is a huge market, like you said. And regulations some are there, but there are a lot that are not.
And not the same as prescription drugs. Again, like not regulated like that
they're
at
not
all.
regulated.
So yes.
Yeah, they're technically regulated as food, right? And there's not a lot of regulation in that field either. But that's to say, I usually use professional grade because I can have a certificate of analyst to know exactly what's in them. That's super important. Quality is super important when you're talking about these. Something as simple as omega-3s, if we go back to that. There is a specific point where those omegas can get rancid. And so if you're taking a rancid omega-3, it's actually causing more inflammation, and the reason you're taking it is to decrease inflammation. And so obviously that's not a regulated field for the rancidity of omegas. So having something in place or looking at places that do that study is important for us. And that's just like one super specific
Mhm.
example,
Mhm.
but I think having that know-how in the professional grade is really important when I'm recommending or even storing those on the shelf. That's important for me.
Mhm. Mhm. Absolutely. And I think, um, w- I mean, the thing I learned about is looking, so maybe not everyone has access to the COAs like you're talking about, if it's something you're ordering specifically, but for a person looking on a shelf, even like the USP verification, or I think there are some other certifications that are available that at least is like another check to make sure that they have what they say they have in the box, at least.
Agree, agree. And that should be on the bottle. Either professional grade will be listed, almost every single professional grade is gonna have a certificate of analyst, so you can actually call the bottle and say, can I see your certificate of analyst? They should be able to send it. We send ours pretty quick. And so just having that knowledge, if
Mhm.
you're housing or storing them in your pharmacy, that's important to know. The regulating
Absolutely.
bodies, how to look for the CFAs, if a patient were to ever ask you. Because I'm sure patients are listening to this and they might start asking.
Great point. Yeah,
Yeah,
absolutely. And I mean, I think too, because it's not just in pharmacies, right? People are getting supplements online from friends, neighbors, who knows. And so,
right.
as you said, it's sometimes hard to tell, but there are some steps we can take to at least confirm the quality is there. Because there have been cases where supplements have been, because as we said before, they're not tested for safety and efficacy the same way as prescription drugs. But once they're
Mhm.
on the market, FDA can pull them or cause them with recall if
Mhm.
they are found to have contaminants or found to cause harm or these sorts of things. But it's after the fact, and so
Right,
we don't want people to be taking something potentially risky in terms of do no harm, do no harm.
right. No harm. Yep. We all sign that oath.
And then I guess along those lines too, in terms of safety. So thinking about in how do you approach a patient with the considerations of potential interactions with maybe other prescription medicines they're taking or other supplements they're taking, or dosing? What kinds of thought processes are you using when evaluating that?
Yeah, so having the full patient profile, because a lot of times they'll think like, oh, I got these supplements OTC, and they're not even considering an interaction between their medications.
Hmm. Hmm.
And asking those specific questions. Are you taking any over-the-counter medications? Are you taking supplements? Because then they will identify that, oh yeah, I am taking this vitamin D and K2 and give you those
Hmm.
kinds of information. That is a lot of times not in the pharmacy profiles, right? In the pharmacies, we don't have access to what they're taking outside of what we are
Hmm.
giving
Hmm.
them.
Hmm.
So having that kind of data is important. Asking those kind of questions to patients is important. Disease state and symptoms is also important if it's a time limiting factor. So if you have a pharmacist that is doing something in the functional medicine realm and kind of guiding them for more help if they're asking for it, um, so they can get all of the details.
Hmm. Hmm. Yeah, I think again for any pharmacist regardless of practice setting, those are just good reminders to be aware of, and again sort of principles we've often learned in pharmacy school, but good reminders
Yeah,
regardless.
yeah, I agree.
Are there any other areas of functional medicine that you think listeners should know about as sort of emerging, or potentially those that are have a strong evidence base that we haven't talked about yet?
So gut health is a huge one right now. And I think that in our conventional care model, they're identifying inflammation, and not identifying causes of inflammation. And so I feel like that's a big area for functional medicine with a lot of emerging details and studies. Probiotics are becoming widely used and accepted and
Mm-hmm.
studied, and
Mm-hmm.
so that I feel like is going to be a huge topic, obviously, coming up. And that also plays a role with how we're processing out our drugs and our RXs as well as supplements. But also like mental health. Obviously, everything's connected. And I think that that's another difference in conventional medicine is we go to specialties in order to like endocrinology specialty, gastro
Okay.
specialty. In functional medicine, I look at this as related to this, as related to this,
Mm-hmm. Mm-hmm.
as a whole body system. So that could be a difference as well.
Yeah, I mean, I think, and again, I think we're getting a better understanding of how that all interacts, and we are one person, and so it makes sense that this is all interconnected in some way.
Yeah.
But and again, goes back to your point about the why and what might be causing this symptom. Is it just something that's passing, or is it something that's related to a more chronic potentially issue?
Deeper issue. Yeah. Agreed.
Yeah. So what else would you advise pharmacists about to think about if they're supporting patients with functional medicine, just as sort of a broad approach, having those conversations? Patients are asking, what like key takeaways would you recommend that pharmacists be thinking about or be aware of before those questions get asked?
Yeah, I mean, going back to the why, like for our own information to help patients navigate this field, because it is going to be talked about a lot more in the future, and you are going to start getting questions, no matter if you work in a hospital or community setting. You're going to get a lot more questions about functional medicine or even homeopathic therapies, supplements. You're going to be getting a lot more questions because there's a lot more information out there. Like you said, it's everywhere. Information is at patients' tips of their fingers. So asking the why, right? So even if you have a patient and you have no idea, they come to you for fatigue or have a question about migraines or brain fog or something like that, and asking the why, like doing a little bit of research on your own, is going to be helpful for you to navigate those patients moving forward, or identifying similarities in other patients, especially with nutrient depletions, and correlating those and being like, oh, I remember that this can cause this, and this patient might have the same thing going on. Obviously, they are all bio-individual, but we do have some similarities and overlap with that when it goes back to especially nutrient depletions.
And maybe just quickly, we gave metformin as the example. Are there other sort of 3 to 5 that come top of mind to you?
PPIs are a huge one, or any type of acid reducer is a huge one. Birth control is a huge one. A lot of seizure medications have a lot of nutrient depletions, as well as blood pressure medications. They all have some major, and it's not commonly one. Like metformin probably gets more than one, but most of the studies are on the B12 for metformin. They just haven't done enough studies to see what else it depletes, because obviously that takes a lot of time and
Sure. Yeah.
clinical knowledge.
Well, and interestingly, I saw that there was an FDA warning just recently, or alert, about vitamin B6 deficiency and associated seizures for drugs containing carbidopa-levodopa. So just another example of how this is continuing to be studied, is going to continue to come up, and another possible thing to have on your radar when you're seeing patients on carbidopa-levodopa, as just one example. Also, too, the other thing that comes to mind is people with particular diets, so like vegetarian or vegan diets. It's not just medications too, it's also your dietary, and again, tying that back to the nutrition aspect as well. So thinking about that holistic approach and full patient approach. Well, Josie, this has been fascinating for me, and
Going back to the
yes,
why.
yeah,
For like B6, that's a cofactor in many systems throughout the body. And so what that can cause and what that can show up as symptom-wise in a patient is important to notate before, seeing the patients roll in with a sufficiency.
Right. And I think the sense I'm getting is that in your education, you got a lot of that additional background that we maybe didn't get in pharmacy school, the rest of us, in terms of sort of that physiological, how it all ties together physiologically, and how that can impact clinical symptoms, even from this sort of mechanistic approach.
Absolutely.
Yeah. So, Josie, like I say, this is a great discussion, great overview of what to be thinking about with functional medicine. I think we got some practical points in there, and just thinking about sort of that person-centered approach, that root cause consideration, that why. Those were the things that came through to me, and also the considerations around safety and prioritizing that, and understanding that we have this varying level of evidence for certain interventions, but that's okay. We just have to work with the patient and work through that. So, Josie, we always wrap up with the game changer. And so what would you say is the game changer around this topic that you'd want our listeners to walk away with?
I would say we'll stay on the theme of questioning why.
I figured that.
I
Yeah.
would say, because honestly, one of my first questioning why is I had a patient come to me. He was a business owner in his 50s, very vibrant. And then I saw the rapid decline in his health over like 8 years. And I started asking why. Like, why is this happening? Why is early onset dementia? Is it hereditary? Is there some nutrients that are missing? Or like I started questioning why in my own head. And that's what kind of led me to dig deeper, is those specific patients that led me to the why. So I think that as pharmacists, we get into maybe a mundane routine of doing the same types of things. And if you look out more broad spectrum and say, okay, I need to start asking why. Like, why is that patient asking for folate? Why is theirs low? What is that causing in the body? Like simple things that you can start putting together just for your own knowledge and to help your patients in any setting that you're in, any pharmacist setting.
Absolutely. I love that. That's a great wrap up. And again, I think we are pharmacists. So traditionally we think about medications, but it is much broader than that when we're thinking about taking care of the whole patient.
Yeah. And then even in the next 10 years, it's going to be a changing, ever changing field.
Yes, yes, absolutely. So we'll have to have you back on as things continue to evolve.
They will for sure.
Josie, thank you so much for your time. This was great, and really appreciate your perspective and expertise here.
Awesome. Thank you.
For those of you who are interested in this topic, CEimpact offers a certificate program called A Pharmacist's Guide to Functional Medicine, which takes a much deeper dive into this topic than we could do today, including how to implement a functional medicine service in your pharmacy. And Josie, I actually think we could probably have a whole other podcast on that alone, and I would love to learn a little bit more about how you did that and how you get reimbursed for that and all that. But this course does provide over 6 hours of CE, so if you're interested, check that out. And Josie is one of the faculty on that course, so you'll be hearing directly from her in that as well. And we talked about a lot of great practical tips today. These will all be summarized in the practice resource that goes along with this podcast. And we hope today's conversation gave you something useful to bring back to your practice. That's always our goal. Before you go, be sure to claim your continuing education credit. Your time and engagement count, and we want you to make sure you get credit for it. Thanks so much for being part of the GameChangers community. We look forward to the conversation with you all next week.